The color of your discharge is not random. It's your body sending messages. Some are harmless, and some are urgent warnings. Do you know the difference? Hi friends, Dr. Emily here, your OBGYN for truth, reassurance, and real answers. Every woman experiences vaginal discharge, but not every woman knows how powerfully it reflects her vaginal microbiome, her hormones, and her overall vaginal health. Your vagina is a living ecosystem, protected by lactobacillus, shaped by pH balance, and sensitive to stress, sexual activity, and infection. And that's why color becomes such an important signal. Let's break down the colors that matter most. Clear or whitish discharge, especially if it's slippery during ovulation or creamier after, is usually part of normal women's health. No strong vaginal odor, no itching, no pelvic pain? Your body is simply doing its job. But when discharge turns thick, clumpy, and cottage cheese white, that's a classic clue for a yeast infection, often driven by Candida. Itching, burning, redness, your body is telling you the balance has shifted. A thin, gray or gray-white discharge with that unmistakable fishy smell? Think bacterial vaginosis, or BV, the most common imbalance in the vagina. It's not always an STI, but it often becomes worse after sex, douching, or using fragranced feminine hygiene products. Now, when we see yellow or yellow-green discharge, especially if it's bubbly or frothy, we think about infections like Trichomonas, Gonorrhea, or even chlamydia. These STI symptoms can be subtle. Many women don't feel sick at all, but when they do, it may show up as soreness, burning, unpleasant odor, or new pelvic pain. And then there's pink or red discharge. Sometimes it's normal, spotting before your period or old blood at the end of your cycle. But frequent vaginal spotting, bleeding after sex, or bleeding after menopause, that's when it's time to see your OBGYN. These can be signs of hormonal imbalance, polyps, cervicitis, or rarely, something more serious. So here's the real takeaway. Color is a clue, not a diagnosis, but it's a clue you cannot ignore. If your discharge becomes yellow, green, frothy, fishy, painful, itchy, or comes with fever or pelvic pain, that's your body asking for help. If you keep treating what you think is yeast but it keeps coming back, your body is asking for clarity. And if bleeding happens at the wrong time, your body is asking for attention. Most of the time, these issues are highly treatable. Testing is simple, treatment is effective, and your peace of mind is worth it. Your vaginal health is not something to be embarrassed about. It's something to understand, protect, and listen to. Because the truth is, your discharge doesn't just show what's happening down there. It shows what's happening inside you. And when your body speaks, you deserve answers. Don't forget to subscribe and follow our channel to get comprehensive solutions for all issues related to vaginal health and women's health.